Hi, everyone. COVID-19 or the coronavirus is a respiratory illness that can spread from person to person. This virus that causes COVID-19 is a novel coronavirus that was first diagnosed in December of 2019 during an outbreak in China. Risk for infection is higher for people who are in close contact with those known to have the disease. These include healthcare workers as well as household members and community contacts. Others at high risk include elderly, immunocompromised, and those with existing respiratory and chronic health conditions. However, there are also emerging trends identifying young adults and youth to be at higher risk than was initially thought. Initially, travel was the common denominator with the transmission of this disease. However, we are now in a state of community transmission, and we are in pandemic status. As a tribal health department, we are closely connected with local, state, and federal entities to address this pandemic. Services have been downsized significantly to address our economic impact and protection of our community and our staff members. We look to the Minnesota Department of Health and the Centers for Disease Control for reliable information. How can you protect yourself? Well, there is no vaccine and there is no specific treatment identified for this disease. Prevention of spread is going to be key to keep our health systems able to care for the increased number of patients over a longer period of time. Number one, stay home. Keep your kids home. We are currently under a shelter-in-place order for Minnesota and Lower Sioux Indian Community. The goal of this is to limit the number of infected at a time to allow for the healthcare system to address the numbers expected needing treatment. Perform hand hygiene often and after touching your face, others, a surface, or anything else that somebody may have touched. Hand hygiene products with at least 60% alcohol covering all surfaces of your hand and letting them air dry are most effective. Washing hands with warm water and soap for 20 seconds. You could sing the first verse of Happy Birthday. That will tell you the 20-second mark roughly. Stay at home if you are sick. Whether it's coronavirus or influenza or cold or cough, whatever it is, stay home. Symptoms of COVID-19, fever. If it's fever you're having, you would want to treat that with Tylenol unless contraindicated by your provider. Dry cough, and then shortness of breath is a symptom that you would may need to seek medical care depending on the severity of that. We recommend calling first to the healthcare provider before you approach an emergency department or a testing center, largely because that gives them the time to prepare and receive you so their workers are protected. Currently, testing is done by Minnesota Department of Health and Mayo Clinic in our region. The nearest test site is Caris Health, Redwood Falls, if they have tests available. Social distancing, 6 feet apart. If you're home or if you need to go out into the public for any reason, keep that 6 feet distance. Also, if you're going to a store or a retail location, make sure that you bring hand hygiene products with you and avoid the contact closer than 6 feet with anybody if possible. Number 5, contact your primary care provider for any urgent but non-COVID related health issues such as medication refills or other symptoms with other illnesses you may have. We recommend calling, doing that by phone. We're also looking at video chat options as well for healthcare delivery from Lower Sioux Healthcare Center in the very near future. Number 6, if you have symptoms, call the nurse line at Caris Health. So Caris Health, Redwood Falls, Monday through Friday, 8 to 5. This number is 507-637-1730. CentraCare Health System has a 24-hour nurse line, and that number is 320-200-3200, and they can advise you whether or not testing is appropriate and whether or not you should leave your home to obtain that testing. And again, if you are short of breath to the point that you feel you need to be in an emergency setting, I would call EMS 911, but identify that you are having those symptoms clearly so that the paramedics can also be protected and wear the required personal protective equipment to enter your home. We will keep you updated, and I thank all of you for listening.